90% of the moms that we recently surveyed reported that they felt out of control of their healthcare decisions before, during, and after childbirth. I am also one of those moms. This is my baby girl, Sandy. About 12 hours after we brought her home, she refused to breastfeed and was dehydrated. Worried, we rushed her to Seattle Children's Hospital. When we got there, the doctors and nurses took her from me and did a spinal tap, a urine analysis, and blood cultures, all on my 48-hour-old baby. As I sat there, recovering, bleeding, and swollen from childbirth, the doctors and residents would say to me, well, if you could just breastfeed your baby, we wouldn't have this problem. From that day forward, I made a vow to not ever let this happen to any other mom. We are different. We believe that all moms and families should have access to just and equitable health care. We broaden outcomes from not just delivering healthy babies, but ensuring healthy moms, families, and communities. And at our core, we believe we can transform healthcare amongst the 300 community clinics that exist within Washington State. So we've all seen it in the news. Serena Williams, Beyonce, Amy Schumer, all reporting their traumatic birth experiences. And most recently, an Indigenous woman here in King County who went to her doctor complaining of shortness of breath and heart palpitations. And they sent her home the next day and she died. She collapsed at her work, she went to cardiac arrest, and she lost her twins and left 2 babies without a mom. So why is healthcare so broken? Well, the speculum on the left, as many women in this room know, has not really changed much. That is an image from 1813. And we can see there that it really hasn't changed. Other than having a lock and a spring, it's pretty much the same thing. Secondly, providers lack connections to their patients, and they have natural biases. A mom we met out in rural Washington was traveling over an hour and a half to go to her prenatal visits. During one appointment, the doctor said, well, you have an STD. And he berated her endlessly about her unborn child. Little did he know that she was being sex trafficked and abused by her partner and was suffering from depression and anxiety. 30% of the deaths, pregnancy-associated deaths in our state, are due to behavioral health issues, suicide, and substance abuse disorders. And the 10 to 12 prenatal visits, I know because I'm pregnant, and the 12 well-child visits that we attend postpartum, how is it not a single doctor can ask us how we're feeling or how we're doing? So why not start here? These are the 300 community health clinics that we have across our state. And in 2018 alone, there were 83,000 Medicaid births. The red stars indicate areas where we have already gone in and started working with moms, providers, nurses, and doctors. So we enter a community, we sit down with moms, we learn about their stories, we talk to the doctors and nurses, and we learn how do we transform healthcare that's more equitable for all families living in that community. We go into the healthcare systems, the actual clinics. We deploy better assessment tools. We do workflow optimization, ensure that appointments move from only 10 minutes to 20 minutes with a patient. We're introducing clinical bias training, which is based off of the stories we hear from moms. And if they have an electronic health record, we do optimization. And if they don't, we introduce new protocols and decision-making tools. And finally, and the most important thing, is we introduce a data analytics platform so they can better track their own outcomes. We're also training up a new role, the perinatal support specialist. And this person lives within the healthcare facility and follows a mom from the point of finding out that she's pregnant to 2 years postpartum. She supports in lactation support, she provides mental health support, and manages the patient from start to end. If we put moms at the epicenter of the decision-making within healthcare, we're giving them the power back to take care of their family. And patient care is critical at being at the center of healthcare. That way, we can get access to things like doulas, mental health services, midwifery, housing, and trauma care. Our request is for $200,000, and we hope to train up to 150 perinatal support specialists, intervene in 15,000 births in our state, and work in up to the 5 counties that we have already started working in. We'll hope you join us as we transform healthcare for moms, families, and communities. Thank you.